No question is stupid. No question is too in depth about your own health. And that is what advocacy looks like. And any doctor that resists you on answering those questions is not your doctor. And because advocacy looks like the way I'm talking about, that means that if you don't like what your doctor is saying, not because you don't like the diagnosis, yeah, okay, yeah, of course you don't like the being diagnosed with something, but you don't like the physician that is giving you this information, you don't have the trust. Guess what? Advocacy also means getting a second opinion, getting a different doctor, getting more information by reading it online or being sent to a specialist. That is what advocacy is. It does not mean that the doctor you have is the end all be all. That's not what that means at all. And so knowing your rights is so important. And that's why we're here.
We're bringing healthy back. Them other bros don't know about the facts.
Welcome to the Magic of Metabolic Health podcast, episode 20, where optimized metabolic health is our goal, and we are here to get you there. My name is Dr. Funmmy Awoyomi, board-certified internal medicine physician, and we have here Miss Amelia Wood, food first personal trainer and metabolic health coach.
Hey, Funmmy, good to see you.
Good to see you too. Here at the Magic of Metabolic Health podcast, we are building a village that encompasses every part of who you are. We release guilt and shame and the quest for perfection, and show you how self-efficacy and knowing your why are crucial tools in sustainable behavioral change and optimizing your metabolic health. Today, we are talking about patient advocacy. We're getting into it. We want to know, why is patient advocacy important? What is patient advocacy, and how it can breach you to getting you to the goals that you're trying to accomplish with your physician and you in the medical industry, in the medical healthcare industry. So today we're talking about healthcare advocacy and why it's important. Have you ever felt like you went to the hospital and you went to go talk to your doctor and you really didn't get a lot out of it? You felt like you were maybe pushed to the side. You felt invisible. You didn't feel like your needs were being met. And it made you kind of have a real bad taste in your mouth about being in the hospital or talking to a doctor, or anything when it comes to do with your body, with medicine in general. So that is not a great feeling. And here at the Magic of Metabolic Health, we want you to be galvanized to be able to advocate for yourself so that you can actually fix your metabolic health, so you can be the best person, patient to yourself. And so that's not going to happen if you don't know how to advocate for yourself with your doctors and inside the hospital. So today we're going to bring that up, and we're going to talk about how to make you the best patient for yourself.
Nice. I'm excited. This is really cool. I'm glad you're leading the way today, Dr. Funmmy.
It's like, no problems, as in this is my bread and butter. So I really have a lot to say about it because I've been personally affected by things that happen in the hospital when it comes to patients. And no better story is one of when I had a patient who came to the hospital. I was working at the clinic at the time. They came into the clinic looking for maybe some mental health therapy. They wanted to be set up with someone that they could talk to about their anxiety or depression. They had already self-diagnosed themselves, but they wanted someone that they could talk to. And so when they came into the clinic, I was under the assumption that they were there to treat their anemia. They were feeling tired. They were feeling fatigued. But upon really listening to them, they were actually talking more about the fact that they felt that they needed medication for their depression, that they were having a really tough time at home. And so it felt like we were talking two different languages. We were both speaking English. I was trying to fix her anemia, her medical diagnosis, but she was like, I have another medical diagnosis and I don't know how to frankly say it. And so it can be so frustrating. It was frustrating for her. It was frustrating for me. And so I think when it comes to communicating, this is a big part of medical, like patient advocacy, how to advocate for yourself so that your doctor can also advocate for you. And so that's why we're talking about it today.
Got it. So I wonder, since I'm not a doctor, like how have you learned from those situations? Like, what is maybe one thing that you do differently now than what you did 3 years ago, as far as that context of noticing or being curious, like, there's something else happening. How do you approach that with your patients?
So the way that I approach it with a patient is, oh, I love this question, by the way. So the way I do it is I am actively listening to my patient. For example, when my patient comes in, most people have like a chief complaint. That's what we call in a hospital. So I'm going to use a lot of doctor talk in this episode. And so the reason I'm using the doctor talk is because I want you to think about what your doctor is thinking about when they're talking to you. So the chief complaint that a patient will come in and they'll say, Doc, I'm feeling tired. I'm feeling fatigued. The first thing, as most physicians will do, is do something called a differential diagnosis. That means off that one symptom that you have brought, I am now making three different diagnoses it can be. And so that I can be able to kind of like hone in about what I think is going on with you. And the more that I actively listen to the patient, they will say, I feel tired. I feel fatigued. I don't have any energy. My heart is racing. I can't sleep. The more my patient tells me about the symptoms that they have, it helps me to narrow down what my three differential diagnoses is into one diagnosis. And so when my patient speaks up for themselves, it makes me a better doctor to diagnose what's going on with them. Yes.
It sounds very similar to my job as a personal trainer or metabolic health coach. Is I was trained to ask open-ended questions, not just yes or no questions, because that kind of creates a dead end, a stop, like, oh, they answered the question, but now what? How do I get them to elicit or elaborate on their concerns? And so the way you do that is like what you said, asking open-ended questions.
100%. 100%, Amelia. And the reason that it works is because a lot of it is just a patient telling you their story. Oh, well, this is how it all started. I noticed that this happened. If you just say, oh, okay, so then what happened? Instead of saying, so you feel this, and they say yes. That's it. That you deaded the entire conversation. No. I want to know. So how long has this been happening for? Oh, how does this feel here? And what does this feel there? And so allows the patient to, give you their story of what brought them to the hospital or to the clinic. And so that we can be able to make a conversation, an agreement of how moving forward we can fix this, because it's definitely not just you and it's definitely not just me. We're doing this collaboratively, right? And so that's
Right.
what makes the best patient advocate stories, when you're like, yes, my doctor listened to me and I was able to say my story, and we both skipped away into the sunset. That's what I ideally would want for the best in the hospital setting. So the way that we're doing the episode today is that we're going to talk about 5 different segments. And those segments are: what is patient advocacy? Second is when's the best time to speak up? When is the best time to advocate for yourself? Third is just knowing the do's and don'ts of how to advocate for yourself. And then maybe the fourth, we'll just talk about the reality and the pressures of what's going on the doctor's side versus what's going on in the patient side. And the last is just about finding your voice in the medical industry, because it's a very big and complex industry, and you could feel like invisible in it. And so finding your stance and finding your voice in it so that you can be the best patient person that you can be. Yeah, let's do it.
Cool.
All right. So first segment, what is patient advocacy and how do we do it? So when I think about patient advocacy, it's not me as the doctor telling the patient, this is what you're going to do. And it's also not the patient telling me as the doctor, I came in the hospital and this is the test that I want and this is the exam I want. That's not patient advocacy. No. Where we are in a partnership. This is not me over you or you over me. We're coming together to fix something that may be broken. And so we're doing it as a partnership. This is what advocacy means. And so when I'm advocating for you, that means that you hired me. So, and I say this all the time to my patients, I did not wake up in your bed and get your clothes on and drive to the hospital. I didn't do that. You did that. So you came to hospital seeking my medical expertise, and I'm going to give it to you. However, you're the person that has hired me to do that for you. You are trusting me with my medical knowledge and my ability to help you figure something out that's going for you. So you hired me. I am advocating for you. But the best way that you can advocate for yourself as a patient is tell me everything that is going on. Not the parts that you think that is important, or the parts that you read up online on WebMD, or the parts that you saw your auntie have or your uncle have, or whatever is going on with you. You should tell me everything. That is the best way I think it is to advocate for yourself. Yes.
Yeah, transparency is really, excuse me, is really important. And I think because I'm a patient, right? Some of the things that can be a little bit hard to talk about are just certain areas of my body that I don't want my doctor to judge me about, maybe. So, I wanted to kind of elaborate a little bit about fear of judgment and fear of maybe the doctor saying, oh, well, you're not taking care of yourself then. And maybe we are, maybe we aren't. But, that dynamic.
All right. So I'm gonna be real with you, Amelia. Your doctor is not going to judge you. And the reason they're not going to judge you is because it's not that we don't care, but the thing is that you're an adult. And as an adult, we assume that anything that you want to do, that you will do. So the best thing that we can do is give you our best medical advice and pray that you follow it. But will you do 100% of everything that we want you to do? Maybe not. Will you do 0%? Maybe. Will you do 100%? Maybe. We don't know. But what we strive to do is we create a rapport. And that just means that we want to be able to, for you to have, we're trained to have an openness with our patients. That it's like, hey, whatever's going on, good or bad, we're not here to judge you. We're just here to get you better. So if you have been having unprotected sex, if you've been taking drugs, if you did not pick up your medication, if you don't check your blood pressure, if you don't do any of the medical advice that has been given to you prior, this is the time to say it. Why? Because your doctor is not going to go, oh, you were a bad patient, so I'm not going to take care of you now. That's out the window. That's not what's happening. It just lets us know it's like there might be some social indeterminates of health. That means things that's stopping you from being the best patient that you can be. Maybe you don't understand what's going on with your health. Maybe you cannot financially afford your medication. Maybe you distrust doctors because of something that's happened in the past to personally to you, or to your race, or to your gender. All of these are very valid reasons why a person wouldn't take their health seriously or not do the things that a doctor would say. So we will discuss those things and be able to see if we can fix that so that we can have a better relationship moving forward. But it doesn't mean that your doctor doesn't care. That's not what's happening. So,
Right. And that made me think of something, the intro where we always talk about releasing guilt and shame.
very
And I think
important.
that is a real thing for a lot of people. We
Yeah.
might know better, but sometimes we don't do better. And that's nothing to be ashamed about.
Hmm.
When you meet with your doctor, especially in a hospital setting, right? You're probably pretty sick if you're in hospital.
Exactly.
And it's really, really important to just the full Monty, just be, let it
Honestly,
all out, right?
Amelia, I'm going to be honest with you. I want to know. I want to know everything that's going on with my patients, and whatever they have to say to me, they could never be ashamed. If anything, after they tell me, I always finish with, thank you for telling me all of that. That's really important for me to know. Thank you for trusting me with this information. I'm not here to judge you. I'm here to get you better. And you already took the first step in making sure that you get the right treatment by giving me full disclosure, and we're going to work on this together. Always, always, I say that with my patients. I want the tea. I want it all. I really do. And so once we have that relationship built, then we can move forward. Okay, okay. So let's talk about your symptoms. What's really going on? Like when has and can start asking the follow up questions. And the more my patients can relax and really just tell me what's going on, so we can get them to get better. Really, that's it. But when it comes to outcomes, like outcomes are better when we have full disclosure. That's how we were able to get over the opiate crisis in the United States. Patients were dying at home. They didn't want to come to the hospital and be seen as a drug seeker or drug user, that kind of thing. And so having full disclosure with your doctor will get you the treatment that you are deserving of. And when patients speak up, it really matters, which is why we're going into our next segment, which is when to speak up, when to seek advocacy. So a lot of the time when we talk about advocacy, there's a couple of things that stops people from really advocating for themselves inside the hospital. Chief amongst them is that they don't know their rights. They don't know in the hospital that you are the patient. And so that's why this episode is called I Am the Patient. You are the patient. You hired the doctor to advocate for you by making sure that they give you the best medical advice possible because you don't know everything about the body. So I'm going to advocate for you because you hired me. So you're the patient, you make the rules. That is why anytime we have to do a procedure, give you blood, anything, we have to get a consent form. That means that I am asking you, here's this thing that we need to do. And if you want to do it, here you're consenting for us to do it. If you don't want to do it, you also have the option of not doing it. That is part of consent. It's just like anything else in consent in real life. If you want someone to do something for you, you have to give them permission. And if you don't want them to not, if you don't want them to do it, guess what? You can take back your consent too. Just like in the real world, the same applies in the hospital industry. And so you have the ability to choose if you want to do something, if you don't want to do something, but you have to understand the consequence. And every doctor, every single one of us is trained in the same way. You have the right to know what's going on. You have the right to choose if you want to do something or if you don't want to do something. So this is very important to know because a lot of people go into the hospital and they kind of have this very paternalistic model, and there's not to anybody's fault. That's how medicine was for a long time. You just listened to your doctor and you did anything that they thought that was best. Times have changed and we have changed. If you don't want to do something, you have the right to say no. Absolutely, 100%.
And if you don't understand what they're telling you to do, or perhaps you don't know, you're not informed about the consequences or the potential side effects or repercussions of what they're telling you to do that's when you say, hey doc, can you explain that to me again in a different way? Or, hey doc, what about this? So if I get this surgery, for example, how is that going to compromise this part of my body or this part of my mind? And, doctors don't have all the answers. They might say, oh, well, let me refer you to a specialist. I'll have them come in and visit with you. That's not my department or whatever. And that's what I love about being in the hospital is there are so many different specialists. Mm-hmm. And although it can be sometimes overwhelming because you have like groups of people coming into your hospital room one after another asking you some of the same questions over and over again, but they do that to make sure everybody's on the same page of where you're at. Mm-hmm. And so, talking about when to speak up is especially important when you don't understand fully what they're saying. And again, they're not going to judge you, especially someone like Dr. Funmmy. She loves questions. She loves curiosity. She loves, hey, tell me more about that, versus just, because we were also raised in a system like our school system here in the US, at least, to just kind of obey, right? Like we just do what our teacher told us. We don't really question it. Most of us. I was always questioning it, of course.
Really?
Just a little bit. But it's subconscious, I think, for a lot of us. We don't realize that we're missing opportunities to not just question authority, but to advocate for ourselves, right?
So yes, so this is 100% important. And the reason why asking questions and knowing when to advocate for yourself is important is because of the language that doctors and hospitals use. Let's be honest, the education level in the United States is very different for everyone. Not everybody finished middle school. Not everyone finished high school. Not everyone went to college. Not everyone finished college. Not everyone's going to understand medical jargon. And so once again, doctors are trained to remove most medical jargon out of the way that we talk with patients, because we need to make sure that it's understandable. And so I might not use the word neoplasm, but most people know what cancer is. That's the same in the medical industry. So I will always try to remove those words out of my language. And so if you find that your doctor is telling you, hey, you've got XYZ, and you don't understand what they're saying, there is no shame, and I mean zero shame, in saying, Doc, I really don't understand what you mean. Can you break it down for me? There's zero shame in that. The one, because your doctor is your advocate. They're supposed to do that. That's number one. Number two, if you don't understand what's going on with you, your diagnosis, then how are you going to be able to know the importance of treating it? How will you know how urgent it is for you to follow up with your specialist? How will you know why it's important to take the medication not just once, but twice a day, or whatever the case may be? You need to understand what's going on with you in order for you to be the best advocate for yourself. So you may have the ginger, or like, the energy to want to do it, but knowing your why is so important. And that's why we're here at the Magic of Metabolic Health. You must know your why in order for you to be the best advocate for yourself. 100%.
So yeah, knowing that just brought up another thing that we were talking about earlier, is not just knowing your why, but questioning whatever the diagnosis is or the suggested treatment. Well, why is this the best option for me and my situation? What are the side effects? What are the other choices I might have that could also be beneficial? No question is unimportant, right? And we can also state our preferences.
Of course.
For example, like, I do not want back surgery, doctor, because I have read and learned that there's a lot of long-term potential consequences. And maybe there's physical therapy I can do first before I do. Do you know a good physical therapist?
Sure.
Things like that.
This is why advocacy is important. This is why we're talking about it, because if you're a patient that, and there's a couple of different types of patients we have. There are ones that they come in and they say, Doc, I don't know what's going on. Just figure it out and fix it. There's ones that are really more like bargaining. They're trying to figure out which medical test would be the least expensive, because they're really concerned about the financial cost of it, or they're concerned about the long-term sequelae. That means long-term side effects. So they don't want to be in physical therapy for 1-2 years. And then you have the ones where they're highly informed. They want to have a sit-down conversation with the physician and know what are the pros, what are the cons, what are the consequences. They even may want to even talk about the evidence-based medicine of the diagnosis, and what studies have been done, and what do you think will be better and comparable, and what are my alternatives. No question is stupid. No question is too in-depth about your own health. And that is what advocacy looks like. And any doctor that resists you on answering those questions is not your doctor. And because advocacy looks like the way I'm talking about, that means that if you don't like what your doctor is saying, not because you don't like the diagnosis, of course you don't like being diagnosed with something, but you don't like the physician that is giving you this information, you don't have the trust, guess what? Advocacy also means getting a second opinion, getting a different doctor, getting more information by reading it online or being sent to a specialist. That is what advocacy is. It does not mean that the doctor you have is the end all be all. That's not what that means at all. And so knowing your rights is so important. And that's why we're here.
And personally, I'd like to share that from my experience in hospital and making some pretty big decisions over the last 10 years of my life, a third opinion is really helpful too.
A third?
Yeah. I mean, I had to make a really big decision about a surgery back in 2020, and then another big decision after the surgery. And I'm thankful and very fortunate to have a lot of resources because of my family's background in healthcare. You know, we interviewed my dad on, I can't remember what episode that was, but he was a consultant in healthcare for over 50 years and about maybe 40. He's not that old. But, I had to learn the hard way sometimes of not getting that third opinion. because it wasn't necessarily completely different than the other two opinions, but there was nuance to it.
Sure.
And that's why I think it might take a little bit extra effort, a little bit of extra time, maybe even a little bit more money. But getting that third opinion, I have found personally, has been really helpful.
I don't blame you. And the reason why is because if I was betting on something and the first bet didn't go in my favor and the second bet went in my favor, the person I bet in the first one was going to be like, you know what? That's 2 out of 3. That's how we bet. That's how we think in our brains. So if I'm getting two different opinions from two different specialists, the third one should be the tiebreaker. So I can understand the need of doing a third opinion. Not everyone has the resources to do the third opinion, whether it's time or money or access, that kind of thing. But if you find that you're not liking the diagnosis, you don't like the situation, it's rubbing you the wrong way for whatever reason, then getting a second opinion, a third opinion is always welcome. And any doctor that would resist you on doing that should be looked at a little suspiciously. I hate to say, only because if I'm a good doctor and my patient maybe doesn't trust me, doesn't believe me, and wants to get a second opinion, all it will do is prove that when they go to that second doctor, that they will say, "Oh, you know what? Dr. Funmmy was right. She said exactly what she said." It only confirms if the fact that I'm a good doctor. However, if it's completely different and it may be what the patient wants to hear or whatever the case may be, they're also entitled to that because once again, I am hired by the patient. I did not go and get this patient in their home. They came to me for my medical expertise. There's no personality in this business. There should be no ego in this business. I am here to advocate for my patient. That's it. Not, oh, I was right. No, you are the patient. I am the doctor. That's how it works.
Can you please say that again?
It was like, yeah, okay, look at me. Look at
Because
me, Amelia.
ego, that word ego.
There should be no ego in medicine, first and foremost. But look at me, Amelia. I am the patient. When you go into the hospital, I want you to go into the look at the doctor. Look at the doctor. It's like, look at me. I'm the patient now.
Yeah, it's true. And, navigating this is like being a detective. And like we're drawing similar life experiences outside of the hospital into this situation. And I want to emphasize the importance of being a detective, even though sometimes you're like, dude, this is not my job. I should not have to educate my doctor or challenge them or question their expertise. However, think about it like when you go to the mechanic. You might not know much about the mechanics of your car, your vehicle. You want to trust that they're going to do the best thing for the best amount of money. But sometimes you might be like, actually, there was this other thing that was happening. Is it related? And which is more important? Because I only have $500 or whatever. What should I prioritize in this situation? Mechanic, person. And so being a detective, I think, as a personal trainer and metabolic health coach, is one of my number one tools that I share with my clients because, again, we understand that expertise is earned. And, Funmmy went through 10 years of a lot of suffering and compromise and sacrifice to get where she is today. So there's value there. And there's value in being your own detective because, like we were saying earlier, you are your best advocate. You are the best expert of yourself. Even if you don't have all the answers, you have lived in your body your entire life, and no one else has, and no one else ever will. And so putting on that detective cap, getting out your magnifying glass, I think it's a little cheesy, but it really helps people understand that it's all relative. Like we are detectives everywhere. We go to the grocery store and we're looking for the cheapest cheese that is our favorite flavor.
Sure.
Like, you're being a detective. You don't really think about it as extra effort or anything, but you want a good deal and you want good tasting cheese. So being a detective in a hospital setting or anywhere else is, I think, it's relative, it's important, and it has to be done.
Not only is it has to be done, it will help you enormously. So I love this analogy of being your own detective because this is power. This your preparation, your snooping around your own life is power. When you come to the hospital, let me give you the scenario of what happens when you come to the hospital when you come to the hospital, whether in the inpatient or the outpatient. You come to the hospital and you tell your doctor, hey, I have this symptom. And so, like I said, I go down and I have this differential diagnosis. Is three off the top of my head what I think is going on. And the more you tell me, the more I can be able to help you and to figure out what exactly is going on. However, if you came with no preparation, you don't know when your symptoms began. You don't know that when it happens, if it's triggered by when you do XYZ, if other symptoms started at the same time, as in you don't have a timeline, you can't describe the symptoms, you don't know the name of the medications that you take, you don't know the primary care physician that you follow, if you follow one. You come to the hospital with almost no information, and then you tell the doctor, here's what's happening to me. The doctor is going to look at you like it's a little bit too vague. I can't narrow down what's going on with you because you got nothing. So the best way to help yourself is by preparing, coming to the hospital with some information about yourself, knowing, okay, if I think about it, actually I went to Uncle Mike's barbecue 4 weeks ago, and that's when the symptoms happened. Now that's something, that's a timeline. Okay, 4 weeks ago the pain started, XYZ. Why is something like the timeline important? Because the difference between knowing when chest pain is a heart attack and chest pain is costochondritis, that just means muscle pain, is literally how long has it been going on for. The difference of me diagnosing if you have vascular issues or if you're having like neuropathic issues is by you describing what kind of pain is it. Is it throbbing pain? Is it sharp pain? So the way that you describe something, the timeline of you describing something, if you're taking other medications, this could be side effects of these medications. If you have a history of allergies, if you have a family history of cancer or heart disease, all of that information is important. And telling your physician that is super important for them to be able to diagnose you properly. So if you want to advocate for yourself, the best way for you to advocate for yourself is knowing yourself. You have to. It's 100% important. It's the most important thing about yourself other than speaking up. So knowing yourself and speaking up, this is part of advocacy, 100%.
Yeah, so we're kind of moving into segment 3, right?
Yeah, we're here in the do's and don'ts of advocacy. And thank you for that reminder because there are a lot of do's, which is, like I said, speaking up for yourself, knowing yourself. But the don'ts are just as important. And the don'ts are don't go into hospital and tell them how it's going to go and how it's going to be. And the reason why you can't do this is because in the hospital, there's certain thing called protocols. So when patients come into the hospitals, we can't just say, I have a headache, and then you watched on Grey's Anatomy that when you have a headache, you need to go and get an MRI. That's not how that works. We have to go down we have to go down like an algorithm, a protocol of, okay, we need to rule out the most dangerous things like, oh, maybe you have a bleed in your brain. We have to start asking you questions. Did you fall? Oh, do you have a history of falling or dizziness or whatever the case may be, or seizures? So there's a bunch of questions that doctors ask you in order for us to get, once again, to the diagnosis. So if you come to the hospital and said, I read on WebMD that this stomach pain that I have is stomach cancer. All right. So you've already diagnosed yourself. However, you don't even know if it's stomach cancer. You don't know what's going on. So when you come into the hospital with a diagnosis already, you're essentially saying to the physician, I don't trust your medical judgment. I read it online that it's XYZ, and I need you to treat me exactly how I've diagnosed myself with. Now, if you went to a mechanic, same thing with the same analogy they use. You're like, I hear a tinkering sound. I need you to change this tube. The mechanic may change the tube for you, but that might not be the thing that actually is broken in your car. They need to do run a diagnostic on your car, and they see, oh, actually, you're actually out of oil, and there's this electrical issue. But if you don't listen to them and you just diagnose it by yourself, guess what happens? The problem doesn't get fixed, and the longer you have the problem, next thing you know, you go back to the mechanic, and this time the entire engine is ruined. You got to fix the entire engine, and now it's much more of a problem, and it's much more costly, and it's much more of a pain in the, so giving your doctor that, I want to call it respect, that
Trust.
trust
Mm-hmm.
to take care of you is very important. And if you have no trust in your doctor, you got to do some self. You have to look within. Why don't I trust my doctor? Why don't I trust the medical industry? What are the things that I'm afraid of? What are the things I'm ashamed of? What are the things I'm feeling guilty about? What are the things I'm worried about? And let your doctor know that that is how you advocate for yourself, so that you can have a better relationship with your doctor. That's how that works.
Right.
And another do is bring in support. So when you advocate for yourself, if you bring your spouse, your partner, your loved one, your brother, sister, cousin, friend, whatever the case may be, you're bringing a different set of ears to the conversation. As long as you allow the physician to have that conversation in front of the friend, because we usually ask, hey, we're going to talk about your diagnosis and the treatment. Is it okay if we talk in front of your friends or family? If you okay it, you now have a advocate, another person beside yourself that is listening to the same thing that the doctor is saying. And so they may be able to ask some questions that you might not have thought to ask. Or they may hear something and may know something about that and has a follow-up question. Another thing is that you guys can then come back together and say, okay, I heard the doctor say this. Did you hear that? And they'll say, yes, I heard that. Or no, they didn't say that at all. They said something else. So having a set of ears that you trust as a person because they are your family or your friend is always going to be a helpful and a welcome thing, because that means that we've reduced the amount of noise that's happening in the conversation. We've reduced the amount of the ability to have a miscommunication, and you have someone else that's advocating for you other than your physician. As in, that's a win all around.
So I have a question, like honest, I have no idea if this is possible, but let's say I don't have anyone uh, because of circumstance.
Sure.
Is it possible to ask for a social worker to come in and help me? Because there are social workers in the hospitals.
Yes.
Is that a
100%.
thing?
Yes, 100%. So there's 3 levels of this. You can ask your nurse, who is the person that's doing a lot of your medical care. So I as a doctor, I diagnose you. I'm looking for all the ways that this can go wrong. I'm preventing a lot of the negative side effects and the negative consequences of things happening. So I'm looking way out. Your nurse is with you 24 hours in the day. Well, maybe like 2, 3 nurses, depending on if it's an 8-hour or 12-hour shifts. So you have at least 2 nurses that with you in a day-to-day basis. They're with you 24 hours of the day, giving you medication, hanging your lines, making sure that you're comfortable, helping you with the bathroom and the stooling and your diet. So they're with you all the time. Any nurse worth her anything would love to be part of the conversation, included on what's going on with the diagnosis and treatment, because they're the ones that are taking care of you. So if you don't understand something, you'd be like, can you have my nurse come in and just like be with me as a fellow advocate? Absolutely. The second level of this is a social worker. The social workers are there to streamline your comfort in the hospital and making sure that remember those social indeterminants of health, like you not having enough money, not understanding what's going on, maybe an education thing or a communication thing, or you not having like a difficult situation at home. Maybe you're in a domestic violence situation, or you have a lot of children and you need more help from the state or the government. Social work is there to help you for that, but they're also there in the capacity of being an advocate for you, because everybody in the hospital works for you. We are working for you, for your health. Our goal is to get you better, faster, stronger, metabolically sexy. That's the whole reason we started this podcast. Amelia, we're here to get people metabolically sexy. So everyone is in that same line of thought to help you. And so I don't think I've ever met a social worker who wasn't crazy determined to have the best care for their patients. As in, social workers are some of the most caring people in the world. So are their nurses, and so are your doctors. So when you're in the hospital, remembering that these people are here to help you is very important, because Because it is. Because it just is.
Yeah. So what was the third one? Because I think you said
Uh-huh.
3 levels.
Yes. And the third one being is that there's also someone called a patient advocate. That is their entire job in the hospital. Their entire job in the hospital is that, let's say there was a misunderstanding between a patient and a nurse, or a patient and a doctor, and you don't feel like you're being heard in the hospital, you're feeling slighted, you may even feel like you want to change nurses or doctors, or you want to leave the hospital altogether. A patient advocate is then called and said, okay, there seems to be a breach in communication. The patient is not feeling happy with the service that's being rendered, because once again, you are the patient. You're the patient. So the patient advocate is called at bedside, and they come in, they're usually very nice. Hi, my name is XYZ. I'm the patient advocate. I'm here to make sure that your wants and needs are heard so that we can get to a proper resolution. That is their entire job. Going around the hospital and making sure that you as the patient feel comfortable, heard, and that we're doing the best that we can to the hospital's ability, to the doctor's ability to make sure that you are taken care of as a patient. So, with 3 levels of patient advocacy, 4, including yourself, I just can't see why this is not something that is being taught to every single person in the hospital, whether you're a patient or a doctor, because we need to make sure that medicine is already tough enough. It's already hard enough being a sick person in the hospital and having to, once again, now advocate for yourself on top of that. But it is our job, and it is our honor and our duty to do so, and we will be doing that.
I just thought of another resource as far as things that you can do to track your progress or track the process in the hospital, and that's your patient portal.
Absolutely.
That is, it has a bunch of different names. There's one company called MyChart
Hmm.
that allows patients to log into each kind of provider system. So it's one system, but there are different hospitals part of that system. So you can log in and see your blood work, the test results. You can see any notes from your doctors or follow ups. You can message your doctor in these patient portals. And so it's a really great resource because, if you're in hospital, especially, it's really hard to remember everything they've said, everything they've done, and
Mhm.
they have to log everything they do.
And
And
by everything, we mean everything.
everything. So patient portals are also something that I utilize a lot.
Okay, wonderful. And honestly, my chart is very common in most hospital systems because it's very user friendly. Your labs are there, the notes are there, your follow up appointments are there. So that if you're someone that, you are trying to be the best patient, but you are quick to forget things, or, you lost your paper at discharge, all of that is in the my chart. And so before you leave the hospital, having your nurse walk you through how to access that so that when you leave, you can still access that is something that we're definitely willing to do. As in, and like I said, but if you don't know to ask that, then you're not going to be able to do it. So advocacy is also learning about what you can do, what you can't do, and how to get the help that you need. And so, yeah, that's how you advocate for yourself. The fourth segment that we wanted to go into is the pressures of what's going on in the healthcare industry, is like what you're not seeing from the other side. So when I mean the pressures, I'm talking about the pressures of healthcare. So what doctors don't see about what's going on with patients, and what patients don't see about what's going on with doctors. So I'll start in the doctor sense. In the doctor sense, patients aren't aware that we have a lot of patients. And by a lot, I mean a lot. The patient to doctor ratio is very high, especially if you are living in an inner city. Right now, I'm in New York. And so there are almost 9 million people in New York. There's only about, what, 5,000 doctors. So just imagine the ratio of how many patients a single doctor will see in a day. But does that mean that your doctor will not use the utmost care in taking care of you and treating you? No, that's not true. The way that we're trained in medical school and in residency is complete care. And so whether I have a lot of time or a little time, I still need to be very thorough in chart checking my patients, looking through their labs, making sure I'm putting in the orders, making sure I'm putting in the medications, and making sure I have a proper diagnosis and everything. So it's a lot of pressure on the physicians, but we are trained to withstand that type of pressure. So the second thing that we're also thinking about is the fact that there's burnout amongst providers because of that pressure. And so you do have a lot of patients. But then you also have a lot of doctors that, after so many years in the medical industry, they do get burnt out because doctors are people. Doctors are people. And so it is unfair to assume that just because they're a doctor, they won't get burnt out or they won't miss something or anything to that matter. And so this is why mental health and just taking care of yourself as a physician is just as important as when I'm talking to my patients. This is why a lot of the times when I'm talking to my patients about metabolic health, I'm so passionate about it because I practice metabolic health in myself. The same magnesium that I am crazy about, and I really am just absolutely nuts about magnesium. The same magnesium that I am prescribing to my patients, I take it. And the same, sleep protocols and sleep hygienes that I tell my patients to do, I do it. And so it is easy for me to not get burnt out because I'm doing a lot of things to prevent myself from burnout. But not everyone is cognizant. Not every physician is cognizant or knows that they're starting to get burnt out. So you have to give your doctor a little bit of grace, especially in that. And then just the third thing is that there's there's a lot of limitations as far as physicians go in the system. And the limitations I'm talking about is with insurance. If you have an insurance company that does not allow us to give certain medications, we know that this is the best medication for you, but your insurance company is not going to pay for it. Then that bill falls on you, the patient. And then the patient then gets stressed out that although this is helping my health, I can't afford this. And so we go back into a horrible loop of you coming back to the hospital, not feeling better because you couldn't afford the medication that we prescribed you. And all because your insurance company does not. So now everyone's frustrated. You, the patient's frustrated, the doctor's frustrated, the insurance company is like, and this is something that we're dealing with every single day.
Wow.
Yeah.
Another reason why I would never go to medical school.
Oh no, Amelia,
Just telling you, man.
It's a beautiful profession. It really
is. And it's just not mine. And I'm so happy that you are in it because you are one of the most compassionate, open-minded, curious, creative people that I know. And I'm gonna make her cry.
I know, right? I thank you, Amelia. It was definitely my calling. I can't imagine anything else I would do. And if I had all the money in the world, if I had all the time and the money in the world, I'd still be doing this. And so that's important because most physicians are not being spurned on by the pay, because what we do in the healthcare industry, the hours and the time and the, like, I'm talking about the sleepless nights and the studying and the years on end of rigorous training. There's not enough money in the world to be trained for this kind of thing. So it has to come from here. It's definitely has to be your calling, what you came here in life to do. And that's why every physician that I know deserves my immediate respect, because I know that they went through it. They went through it the way I went through it. And so that being said, I want to keep those pressures that the physicians are having in mind. But then patients are also experiencing pressures, and that's the other side of it. And that is the emotional labor of having to advocate for yourself. Because now you're already tired, you're fatigued, you're already frustrated, you're in the hospital, you're feeling sick, and now on top of that, you have to fight for yourself. You have to, and it shouldn't be a fight, but you're essentially feeling like you have to fight for yourself in order for you to get the type of treatment that you deserve. And while you are deserving of treatment, it is exhausting to fight for yourself when you're supposed to be healing. And so that is the other side that maybe physicians are not seeing about the patients. Because you're already probably deconditioned at home dealing with the situation. Then you come to the hospital, you're still feeling sick, you're trying to get better, but you're not getting better as quickly as you want to get better, or the remedies that's being offered to you are none of the ones that are compatible with you, or you're just feeling kind of like defeated. That could be very frustrating. That 100%. Another thing is just feeling guilty about being difficult in the first place. So this idea of being difficult, once again, you are the patient. You are the main character. You came here and said, hey, You're my doctor now. Fix me. So you're not being difficult by asking for the healthcare that you deserve. As that's dead. That's done. You're not being difficult by asking for the healthcare that you deserve. I'm going to say it again. And the reason why is because, once again, you're the person that is seeking help and we're here to help you. So you should never think that you're being difficult. And you should also never consider the consequence of being difficult as you're not going to get the right care that you need or we're going to dismiss you from the hospital. That doesn't happen. And the reason why is because you have rights when you come to the hospital. We are supposed to treat you. We will not abandon you. Patient abandonment is almost zero. What we're trying to do is help you and get you to the treatment that you need. If you're not happy with the treatment, we have the several levels of advocacy. If you find that you still would like to go to another place, then we will refer you to another place or refer you to another doctor or refer you to a specialist. But at no point will there ever be patient abandonment, because this is a big no-no. This is a big no-no. We don't just abandon patients. It's very much against the Hippocratic Oath. And so we're here to help patients. We're here to do no harm. That is something that we take very, very highly. And so doing no harm is part and parcel of who I am. Even I take care of patients that have ideological differences than me. All of that gets thrown to the side because I'm here to help you.
Yeah.
Yeah.
Wow, that's a great summary.
I know, right? It's like, and that's really what it is, and that's really what it is. So we want to kind of just think about it in those ways when we're talking about that.
Yeah, for
The
sure.
last thing, because we want to make sure it's nice and summed up here, is that we want to really just talk about how to be your best advocate, why it's important to be your best advocate, and how to do it. And so in this segment, we're going to talk about what we've been noting this entire episode, which is I am the patient. Look at me now. Look at my shoulders. Look at my hips. I am the patient. So I am the patient does not mean I will disrespect to others or I am not that I'm not grateful for what's going on at hospital. It just means I am the person that knows my body the best and I know that something is off. I'm going to this medical specialist, my doctor, who's going to help me figure out what's going on and if there's a remedy. And because of that, that means that I hired my doctor. My doctor works for me. I am the patient. I am the main character. So how do I best help myself in this situation? So before you go into hospital, you have to tell yourself, I am the patient. Come on now. Me, I'm the patient here. And so that little hype up, that little ginger to help you get there is important because you don't want to feel like you went to the hospital and you got lost in the system. You're invisible. No one's listening to you. That's the stuff that's gonna piss you off. Let's call it a buck. It's gonna piss you off, and you're not gonna feel like you want to be in a hospital. And that's why so many people have such a negative opinion about being in a hospital. You're already sick. You're in a hospital. You don't feel like you're being heard. These are things that we're trying to eliminate. So knowing what your rights are and being able to advocate for yourself, and knowing that I am the patient, not you are the patient. I am the patient. So that change in perspective is very important.
Yeah, and I think we've covered this a little bit, but trusting your instincts is something like your gut feeling is something that I think can be overlooked and kind of pushed to the side sometimes because let's say I have an instinct, but I don't have any research or data or evidence to counter whatever my doctor's saying.
Sure.
But there's something in my body, I'm like, something's not right. So making sure you trust your instincts and again, ask more questions or share like, yeah, doc, something doesn't really feel right. I think I need a little bit more information or I just need to sit with this. I can't make a decision right this second. Can you give me a few moments, because in hospitals, sometimes there are urgent things to take care of. But if, there's a surgery that's planned, that's up and coming, you have time.
Yeah.
You have time.
I love this. I love this phrase. Something doesn't feel right. Let me tell you something. When I'm in a hospital, and so when I'm in a hospital and I hear the phrase "something doesn't feel right," like I have like an antenna that just goes up, and it becomes like, hold on a second, let me go back and look at this again. And then with very, very careful eyes, or I might even ask a colleague to come in and just like, take a look at this patient, new eyes. Why? Because when a patient tells me that something doesn't feel right, because I trust you to know how you feel on a day-to-day basis. And if those keywords of something doesn't feel right, I've never felt this pain before. That is a big difference. That's a stark contrast between every day you're living normal and then boom, something is different. That's a big enough signifier that you came to the hospital. People don't just come to the hospital for no reason. They don't come here for fun. They don't think of this as Disney World. And so if you came to the hospital and something doesn't feel right, your doctor is interested. They want to know what's going on and they are trying to look for a solution for you. So if something doesn't feel right, say something. You have to say something. I remember a cardiologist I was working with. Um, can I even say his name? I'm not sure if I can. I was like, I won't say his name. But he's kind of a big deal. So he's seen every kind of heart attack, any type of surgery. He knows everything about the heart that can be known. Should I say his name? He's kind of a big deal. Anyways,
I don't know. I
no,
mean,
he's like, I consider him a mentor to me, but
oh,
he's wonderful.
is he going to
What
be
I'm
on the podcast?
Actually, he might. Actually, I'm gonna reach out to him. He's great. I will reach out to him. But no, getting to the story, Amelia. The fact of the matter is that he's seen everything. So when you come into hospital, you have a bit of chest pain. They do something down the protocol again. They do an EKG. They do troponins. They may do an echo, which is an ultrasound of your heart. They're trying to figure out if there's anything electrically wrong with your heart, structurally wrong with your heart, or if your body is giving off something called troponins, which means that you've got a little stress on your heart. So if those things look normal, they kind of stratify you as high risk or low risk, right? So if those things are normal, and then you still say something ain't right, I think he saw like a bead of sweat come down the patient's temple. And that was like, what in the world? And you just said, you know what? Let's just take you to the cath lab and let's just do a cath, which means that they're going to look inside the coronary arteries of the heart. They went in there. It was a massive heart attack, that the biggest heart attack that he's ever seen in his life. And the man pretty much had just a little, no symptoms, just a little chest pain. But meanwhile, the reason why, and I know this is scary. And so the reason why it's scary is because if you're someone that is diabetic, the nerves of your heart, the nerves of your body has been insulated by the amount of sugar in your system. This is why diabetes is such a critical diagnosis, because the pains that you would normally feel, you don't feel them now because they've been numbed by the fact that your nerves no longer work like they should work. And so that little chest pain that patient was having might have been a tearing chest pain that could incapacitate him, but he couldn't even feel it. If not for the just him advocating for himself, doc, I just don't feel right. And for that physician to just take another look at him, that man would have went home and died that night.
Wow.
But they took him to the cath lab. They managed to put I believe they put something like 7 stents into his heart, which is a crazy number already for the first heart attack. You put 7 stents into somebody, and that saved his life just by saying the words, something doesn't feel right. Now, I'm not telling you as a listener to go into the hospital and you just go to your doctor and say that something doesn't feel. I'm not saying that these are the magic words. I'm just saying is that advocating for yourself, you deserve good medical care. And you deserve to be heard. You deserve to have a physician that cares about you. You deserve a good life. Like, I have no better words for this. This is what you're
Yeah.
deserving. And if you don't know you're deserving of it, let me tell you, you deserve it.
Yeah, I think we've covered the bases. We have been very thorough. We've also been a bit repetitive, but because there's a good reason, right? We want to emphasize the importance of these things and the possibility of becoming your best advocate
Yeah.
alongside your doctor, right? You're not
Yes.
in this alone.
No, not at all.
Uh, I I sometimes get frustrated personally because I I'm not I have no training in medicine. I have no training in healthcare officially.
Hmm.
I dabbled in little things, in my personal trainer certification and other classes and courses I've taken.
Hmm.
But like I said earlier, it's not my job to educate my doctor. However, if I have some really golden, juicy information, research, data, evidence
I want
that
to know
is
it.
not common knowledge, even though you would assume that a doctor would have this knowledge,
Sure.
I pick and choose when I share it, and I don't throw it in their face. I just say, what do you think about this study? Or what do you think about this experiment? Because, like Funmmy, you were saying, there are some limitations in the system. So even if I give this information to my doctor, they might not be able to legally
Hmm.
agree and say, oh, well, then let's do that. Because so and so, whatever institution or organization, says that that's not part of their standard of care.
Sure.
But I just wanted to bring it back to, the power of information, the power of access that we have. And the internet is a scary place, but it's also a very empowering place. It can be, if you cross check and double check references and comparisons and criticisms of different, studies or things like that. You can find some really valuable information. And for those of you who maybe are a bit bold like me, and you're not afraid of saying, hey, doc, I have some information that contradicts what you're telling me right now, go for it. Do
Yeah.
it in a respectful way, but
Yeah.
don't be afraid to challenge, whatever is going on. If you have some solid evidence or whatever, that's been challenging for me, but I feel like I'm getting better at communicating those desires and also just intentions, right?
100%, Amelia. As in, medicine is changing every day. How we did medicine 10 years ago has changed radically than how we do medicine now. New studies come out that debunk old studies. And so we're constantly, that's the whole part about being a doctor. That's why doctors go to conferences. And that's why we continue to lean on each other for support, because new things are coming out every day. And so the best doctor in the world are well-informed doctors. And so we're always reading, we're always getting ourselves better. And so we are trying to be the best doctors that we can be to you. And so being the best patient that you can be, also, as in, we have to do this in collaboration with each other, like I said earlier. And so the best way to think about it moving forward is not me versus my doctor. It is my doctor and I versus the issue, which is that we're in cahoots. Me and my patients like this, we're like, okay, so what are we going to do? Not, oh, you're on your own. Like I hope that solves itself. No, no, no. It's me and you. What are we gonna do about this? All right. Let's talk about this. Let's make a plan. And once you have that feeling with a doctor, as in you'll never go back, because you'll be like, yes, absolutely. This is exactly 100% what I've been looking for all along.
This has been an amazing conversation.
Me
I
too. I love this. I love
I
this.
got a lot out of it.
Did you really?
Yeah. Well, I mean, I tell people my doctor says, and I talk about you.
I'm, I'm your doctor.
You're not my doctor technically, but you are my doctor because I get to pick your brain and I get to spend hours with you having these open dialogues, and it's very enlightening. It feels good, it feels empowering to have someone on the inside. You're my
Mhm.
insider, right? And I hope that you're also being the insider for all of our listeners, because you don't have this time, like us patients, we don't have this time to pick our doctor's brains and ask all the
Mhm.
nuance and the questions. And this is amazing. I'm really glad that you wanted to do this episode.
honestly, I'm glad that, you know what, it came to me like suddenly, like we haven't talked about this. But yeah, if the listeners don't know, I am your doctor. I'm America's doctor. I'm your doctor. And the reason why I'm saying this is because you can ask me any question. As in, maybe we should do like a Q&A session, or we can ask me any question, send me a DM, put down a comment, subscribe to our channel, ask us what's going on with you and how we can best help you. That is what we're here for. We're here to make you metabolically sexy. We're here to show you what the magic of metabolic health looks like. And it is truly magical. It really is.
Yeah, and we never give medical advice. Simple as that.
Right. We don't give medical advice, but we could definitely,
we
push you
offer
in the right
education. We
Yeah,
offer
education.
education.
Indeed.
Yeah.
Indeed.
And we
Indeed.
have lots of resources for folks who want medical advice. Like if you need a new doctor, I highly encourage you to check out the smhp.org. It's the Society of Metabolic Health Practitioners. It's a global network, and it's got every doctor under the sun, including dietitians, cardiologists, family physicians, tons of specialists. And we've talked about the SMHP before. They put on metabolic health symposiums multiple times a year across the US. They partner with international folks as well. So we'll make sure that the SMHP website is in the show notes, and I'll also put in a link of the patient handouts that they have on their website, and one of them is how to talk to your doctor about labs.
Yeah.
So
Important.
it's a great resource, especially if you want to find a doctor that is metabolically minded and metabolically trained, so they understand the nuances of things and how things that you think don't connect are actually related. So highly recommend them. And what else? Do we have anything else we want to share?
That was pretty much it. That's why, as in, it's been an hour. We talked really a lot about advocacy. I don't think I can say anything else that we haven't already said. If by the end of this episode you don't know how to walk through this thing, I don't know. I got bad news for you. No, but this has been a fun episode. I'm glad that we're able to just remind everyone this, like, about the importance of this, and I look forward to the next time I see you there.
Oh, I just remembered, for those of you who are interested in learning more about your metabolic health, we do have a discount code if you want to get a CGM, which we also talk about pretty regularly here on the show. The CGM, continuous glucose monitor, and that is a 2-week device that sticks on your arm that tracks your blood sugar 24/7. It comes with a free app that you download to your phone. And if you want to buy one singularly, if your insurance doesn't cover it for whatever reason, you can go to hellolingo.com and type in Metabolic Magic, all one word, at the checkout for a discount on your first CGM.
I might get one. I'm gonna use that discount code and see if because like I already know what my blood sugar is doing. It's pretty stable, but I want to see. I love using something before my patient uses it, just to see if I can be able to like really tell them, oh yeah, I noticed it's best on the upper arm. I noticed when it's, but I love being able to give back that feedback. And so yeah, I'm gonna go to, is it Lingo?
HelloLingo.com.
Lingo.com and use the code Metabolic Magic to see if I can get my CGM today.
Nice. All right. Look at that. Look at that. All right. Well, folks, you are the first line of defense in your health. And we are all the magic of metabolic health. So we really appreciate you. Thank you for being part of our village. And we'll see you next time.
Take care of yourself.
See you, Funmmy.
Bye, Amelia.
We're bringing healthy back. Them other bros don't know about the facts.